administration of diet, of each or of all of these, and this quite as much in private as in hospital nursing. The reparative process which nature has instituted and which we call disease has been hindered by some want of knowledge or attention in one or in all of these things, and pain, suffering, or interruption of the whole process sets in. If a patient is cold, if a patient is feverish, if a patient is faint, if he is sick after taking food, if he has a bedsore, it is generally the fault not of the disease, but of the nursing. I use the word nursing for want of a better. It has been limited to signify little more than the administration of medicines and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. It has been said and written scores of times that every woman makes a good nurse. I believe, on the contrary, that the very elements of nursing are all but unknown. By this I do not mean that the nurse is always to blame. Bad sanitary, bad architectural, and bad administrative arrangements often make it impossible to nurse. But the art of nursing ought to include such arrangements as alone make what I understand by nursing possible. The art of nursing, as now practiced, seems to be expressly constituted to unmake what God had made disease to be, namely, a reparative process. To recur to the first objection, if we are asked, is such or such a disease a reparative process? Can such an illness be unaccompanied with suffering? Will any care prevent such a patient from suffering this or that? I humbly say, I do not know. But when you have done away with all that pain and suffering, which in patients are the symptoms not of their disease, but of the absence of one or all of the above-mentioned essentials to the success of nature's reparative processes, we shall then know what are the symptoms of and the sufferings inseparable from the disease. Another, and the commonest exclamation which will be instantly made is, "Would you do nothing, then, in cholera, fever, etc.? So deep-rooted and universal is the conviction that to give medicine is to be doing something, or rather, everything. To give air, warmth, cleanliness, etc. is to do nothing." The reply is that in these and many other similar diseases, the exact value of particular remedies and modes of treatment is by no means ascertained, while there is universal experience as to the extreme importance of careful nursing in determining the issue of the disease. The very elements of what constitutes good nursing are as little understood for the well as for the sick. The same laws of health or of nursing, for they are in reality the same, obtain among the well as among the sick. The breaking of them produces only a less violent consequence among the former than among the latter, and this sometimes, not always. It is constantly objected, but how can I obtain this medical knowledge? I am not a doctor. I must leave this to doctors. O mothers of families, you who say this, do you know that 1 in every 7 infants in this civilized land of England perishes before it is 1 year old? That, in London, 2 in every 5 die before they are 5 years old? And in the other great cities of England, nearly 1 out of 2. Footnote. Upon this fact the most wonderful deductions have been strung. For a long time, an announcement something like the following has been going round of the papers. More than 25,000 children die every year in London under 10 years of age. Therefore, we want a children's hospital. This spring there was a prospectus issued, and divers other meanings taken to this effect. There is a great want of sanitary knowledge in women. Therefore, we want a women's hospital. Now, both the above facts are too sadly true, but what is the deduction? The causes of the enormous child mortality are perfectly well known. They are chiefly want of cleanliness, want of ventilation, want of whitewashing. In one word, defective
to keep listening to this audiobook. I've left you a link in the description so you can do it, at no cost thanks to Audible's 30-day free trial.